This is Dr. Robert G. Watkins III, Director of the Marina Spine Center and spinal surgeon to professional athletes. This is Dr. Robert Watkins, and my topic is really the discussion concerning why we use stabilization training in our treatment programs for all our patients and our training programs as well as treatment programs for the athletes we take care of. It began really with a basic understanding of the biomechanics of the spine. Harry Farfan, and like Alf Brieg, Harry Farfan and others have shown us what happens when you bend and move and twist. What happens when you bend forward and your spine goes into flexion? Well, we know your interdiscal pressure goes up. The nerves become taut in your body when you arch your back. The nerves become slackened. The interdiscal pressure goes down, but the spinal canal closes. So you take symptoms that people have, and you, by analyzing exactly what the chief complaint and the symptoms are, you're able to relate that to the biomechanics of the spine and therefore begin your diagnostic evaluation of the patient. And then you combine that with the MRI, the physical examination, the testing, and basically we want to know what nerve is involved, what level the spine is involved, and what pathology is causing the problem. And then you move into from this understanding of the symptoms and the determination of an exact diagnosis, then you move into a treatment program. Why did we use core stabilization training? A lot of the initial input to me was provided by Dr. Art White, Jeff Saul, and the rehabilitation of Joe Montana's back surgery when he first played. I was very curious. I was in the position of taking care of athletes. Why do they have such a good result? And they're close friends of mine. We discussed everything, and the stabilization training became more obvious. It fit right into balance and coordination type exercises that everyone in rehabilitation was looking at, from use of the exercise ball in cerebral palsy children in Sweden. I was exposed to that overseas in England with the rehabilitation processes they were using. But what exactly happens with this type of training program, and how do we analyze that? The Gate Laboratory at Sentinella Hospital was run by Dr. Jacqueline Perry, the first female member of the AOA, a prior spinal surgeon who worked in Hong Kong, taking care of major spinal deformities, and she ultimately worked at Ranchos Los Amigos Hospital in Downey, California, where many during that era foreign spinal surgeons, some ultimately becoming some of the most famous spinal surgeons in the world, trained at Rancho for a year in a fellowship. And I was in training as a resident in that era and became familiar and did studies with Dr. Perry. She moved to a Gate Laboratory at Sentinella Hospital with Frank Jobe, who was evaluating professional athletes. And the study we came up with and the study we did at Sentinella, Dr. Perry, Frank Jobe, and myself as the primary investigator, we evaluated professional baseball pitchers, PGA golfers. It was the winter physicals for the PGA at that time, and I was the main spine consultant for over a decade through the work with Frank as the primary physician. And we analyzed what happens when you do these sports activities. And we did gait analysis of trunk musculature by literally implanting electrodes and having these very cooperative men do their sports for us in the Gate Laboratory. And what we found was reasonably shocking at the time. By testing the different muscles of the core, meaning the abdomen, trunk, glutes, and other things that contract and perform in these rotational sports, we demonstrated a median firing sequence of muscle activity during the athletic activity. The best were the Major League Baseball pitchers because they tended to have a similar type motion. And I was amazed to realize that we demonstrated a coordinated sequential pattern of muscle firing depending on the phase of the throw. So different muscles were contracting and providing power through different aspects of the pitch. So where the arm was in space, and therefore where the ball was, different muscles fired to produce the ultimate release point. Different cinematography done at Fenway Park by Dr. Pappas and others showed that if your back is sore and painful, your release point is off, generally high, and the ball comes up in the strike zone. So having this coordinated power and strength in the core muscles is what accomplishes what you want for the sport. A proper release point with a proper velocity. And we demonstrated it in the lab. I was amazed, but it showed this coordinated core strength. And then it became, and we did the golfers, the PGA golfers. We didn't have a big enough sample to demonstrate in the golfers because the golfers each performed a little differently. There wasn't this sequential exact firing pattern that the Major League pitchers had. Major League Baseball outfield, for example, he could throw the ball through the wall, power and strength, but he had no median firing sequence like the starting pitchers did. And a converted outfielder took a considerable period of time before he was able to develop this type of coordinated strength. It was really reasonably amazing. You realize that every sport, from throwing a javelin to crew to everything, that especially when there's rotation involved, there is a coordinated sequential firing of these muscles. So balance and coordination is the key to performance, and it is. It's the coordination of these firing sequences. Coordinated muscle function is much stronger and efficient than uncoordinated muscle function. Uncoordinated produces fatigue and lack of full performance and more risk and injury to the spine. Coordinated function not only puts the hand at the right place, if you will, but also protects the spine better. So back injuries, for example, and crew happen all the time, and developing the performance necessary through training for the sport, cross-training through a core stabilization program is going to produce better coordinated core strength to perform the sport and protect the back. So how do you protect your back if you're bending, twisting, lifting a dog, mopping the floor, getting stuff off a shelf? Well, you want these muscles to fire to protect your spine. And so you have maximum strength protecting your spine. It's like taking a cylinder. For example, your spine is about 2.5, 3 inches in diameter. Well, if these muscles are firing to protect your back the way they should, suddenly you've got an 18-inch or a 28-inch thick cylinder functioning to protect your spine. It's a lot harder to break a 4-inch cylinder than it is a 28-inch cylinder. So the muscle and power and strength of the abdominal wall, the core muscles, your back paraspinous muscles, the glutes, and the lats all fired into this mechanism. Well, how do these muscles affect your spine? They attach to your spine. They attach through the lumbar-dorsal fascia and fascial tissues into the spine itself. And it's like I kind of liken it to a circus tent that immobilizes a flexible tent pole, like a big circus tent, except the pole's flexible. It's not stiff like a normal tent pole. It's moving. And so these muscles contract. It controls the through the tendons, which is the circus tent, into the spine and makes it work right mechanically. So often when we discuss with patients, we look at an MRI, there's an abnormality there, we point that out, and the patient says, well, as long as that abnormality is there, I'm never going to get rid of this pain or be any different. Well, that's a good selling point for surgery, but as a practical matter, it's incorrect. Looking at an MRI is like looking at a still picture in the middle of a movie. It's how it works is what counts. Orthopedics is all about function. And so what you're looking at on that MRI is a moment in time and a movable object and a motion picture. So it's what happens when it bends and moves and twists is why that one structure doesn't have to be removed all the time, because we're going to compensate for that abnormality by building a better machine and making it work right mechanically. If it's working right mechanically, it won't hurt. And so that's our approach to trying to treat things non-operatively that may require surgery in order to produce a proper result. So the key thing is build up this coordinated core strength. The added component we need is endurance. Because, like, if you're playing in a game, well, we're talking about the third quarter, the fourth quarter. We're not talking about the warm-up. So you've got to be able to get to the end of the line. And we're going to do that through exercises that have an endurance component to them. So basically, you're going to do the same exercise for 7 or 8 straight minutes with excellent technique. That builds up your endurance. So in the third quarter, those muscles are used to doing that. They're going to be able to perform and give you that coordinated core strength for a full game, not just the warm-up. So endurance component is critical. It's not like going to one of the gyms and having someone work you out and you do 20 seconds of this really interesting, fascinating exercise. You're standing on one hand, one foot, and doing something weird, but you're only doing it for 20 seconds. That's not what our program is. Our program is you're going to do these 8 or 9 same exercises with with excellent technique for a longer period of time. You're going to do it 7 straight minutes of the same exercise. And then we're going to be able to branch out to make the exercises tougher at higher levels of our 5-level program. They're going to be more difficult to do, but they're still going to have that endurance component where you're going to do it for a long period of time. How do you start these exercises? We talked about the flexion and extension. We know that flexion builds up interdiscal pressure, extension opens the spinal canal. That's why programs like the Williams flexion exercise and the McKenzie extension exercises that relaxes nerves can be effective, but I think the motion and through the lumbar spine in some of these programs predisposes it to injury. Our program, you lay on your back, knees up, feet on the ground, mouth open. We don't want you bearing down and holding your breath, and lock, and your back is in a neutral. Put it in a pain-free position where it's not hurting. In that position, hold it in place, lift one foot up for 3 seconds and put it back without letting your back move. That's how the program starts. So in a post-op patient who's had spinal surgery, laying on his back, knees up, feet on the ground is a pretty safe position. So we're going to use that safe spine position to expand into an important strengthening component of our program. And I once had Vert Mooney, as an excellent orthopedic surgeon, famous orthopedic surgeon, tell me, well, your system's not going to work because a shortstop can't be trying to keep his back stiff while he's out trying to play. And I told him, no, it's just the opposite. He's not going to be thinking about his back because we've trained these muscles that when he bends and twists and throws and makes these god-awful moves that a shortstop makes, his muscles are going to fire to protect him because we've trained his trunk muscles to protect his spine and give him the torque able to throw. In a Major League Baseball pitcher, one of the worst things that can happen is to be thrown off balance because he's hurt his toe, the Dizzy Dean effect. He's hurt his toe and throws off his arm, and he hurts his shoulder then because he's trying to throw. Well, back pain produces a loss of balance and coordination. So if we have an adolescent with a stress fracture in his back, it's going to take him 90 days to get back to his sport. Because if he tries to perform his sport with a painful back, he's going to make his back worse because he doesn't have the coordinated core strength that's been short-circuited. He's going to hurt his back worse, and he's going to hurt his shoulder or something else because he can't transfer this torque properly. So general rule is stop whatever's caused the pain, whether it's playing shortstop or whether it's a certain move or something like that. Go back and retrain the trunk muscles through this neutral pain-free position to fire and protect your back when you move back into these awkward positions of your sport. So assume the position, neutral pain-free position. That's what we're training these people's spines in, the neutral pain-free position. And we're going to come out with a stabilization score. So you can do a 3.2. That's the average over the different exercises with good technique. Well, 3.2, an NFL football player can go back to the weight room for a modified weight technique. And we know how many throws a pitcher can make with what velocity and when he can get on the mound based on his stabilization level. And so we gauge what you're able to do in your sport-specific training. The next step in an athlete, once we've established his core strength and his functioning properly, is that he has to do sport-specific exercises. At one time, we had, when I first started evaluating football players, I realized there were a lot of injuries in the weight room. And I said, well, you should never do deadlifts or certain of these weights until I found out through further investigation that 90% of all football teams do these exercises and do these certain lifts because that's what makes you proficient at your sport. And it also became more than obvious at that point. We have an injured athlete. We're going to train and get them to do level 3. Well, they've got to train for their sport because the position coach, the strength and conditioning coach for the team, and the trainer for the team, they know what it takes to perform at the level necessary in their sport. NFL guy wants to be able to play cornerback, defensive tackle. That's his job. So part of my job is to train the person to do what their occupation is. And that's where the work and coordination with the team becomes very, very important. You've got to work through these people that know how to make this player proficient at his sport while we institute these other changes that can protect their spine and enhance their sport-specific exercises. Ultimately, there's 6 different levels of you need to address prior to return to activity. Number 1, we've said core strength. Well, number 2 is aerobic conditioning. You got to be in shape when you go back to the sport. If you go back out of shape, then you're going to lose your balance and coordination through fatigue. Remember, fatigue is our enemy. Makes cowards of us all. But it'll make a coward of your core muscles too, because they won't fire right to protect your spine. So we're going to have to work in through first. The aerobic condition has to start with a technique that doesn't hurt your back. For example, an elliptical, holding on in the middle and not using the hands, is a reasonably safe way to start aerobic exercise, regardless of your sport. But ultimately, it's going to be sport-specific conditioning. The aerobic conditioning for a defensive lineman is different than a wide receiver. And runners are ultimately going to have to go back to running, and swimmers are going to have to go back to swimming. So it may be the very thing that hurt their back they're going to have to return to aerobically, and that's your job, is getting them back to that level. Extremity strength is important. If you look at hockey players' thighs and butt lately, I mean, they're strong, very strong. They work in a crouched position a lot of the time. And also like bending and lifting. One study showed that the ability of workers in a meat packing company to return safely to lifting job depends on their quad strength more than their back strength. So if you've got to use this power in your butt and your legs to do the lifting for you. And so doing wall slides from the very beginning, I had one NFL player say that I used to be able to leg press 700 or 800 pounds. These wall slides are killing me. So do the wall slides properly, build up the strength in your legs and your quads. And for example, if you have an injured knee, and you can't squat, well, your back is much more vulnerable to injury. So you've got to take care of the extremity problems, build up the strength in the legs to allow that power, whether it's just getting on and off the toilet. You got to power up with your legs. You can't be bending forward with your back and using leverage to get up. Next thing is extremity flexibility. Tight hamstrings often are the result of the spine problem, where it's your hamstrings are tightening up because you have a spondylolisthesis, and it's irritating those nerves reflexively. But at the same time, we don't want some rehab person using your long lever arm of this heavy leg to manipulate your back. So we do core stabilization and isolation first. Lock your back in place. Then do your extremity stretching exercises, whether it's quads or hamstrings, while protecting your back and not allowing that leg. Too often these hamstring stretches are making your back worse because it's using that long lever to manipulate the stiff, painful back. So extremity flexibility is important. Brett Fisher, one of the top rehab people in the country, when we were together on the PGA Tour, traveling, taking care of the golfers, Brett liked to start with the feet and the ankles. If a guy's got a stiff ankle, it's going to throw off his swing. So he started by loosening up knees, joints, hips, and ankles, starting at the bottom and working up, which is, for a golfer, excellent way to approach a back problem. So extremity flexibility is important. The next thing is weight training. Almost every sport and every general workout now, people do weight training. And you've got to do it properly. Good technique is critical. Having a proper weight instructor to keep you from hurting your back. For example, the squats and deadlifts with weights that give you the power in your legs so that you can do certain sports, well, we're going to modify that. There are different techniques now that you can modify your weightlifting to protect your back. And one thing is very important to realize: if you have weight on your shoulders and you're doing some type of squat, as soon as that weight has to stay on your heels. As soon as it gets forward, it's weight times distance. So if you've got 200 pounds on your shoulders and you're bent forward 8 inches, well, that's 8 times 200 is the foot-pounds of force through that lever arm effect that's exerted on your spine. So verticality on your squats, all these techniques that good weight instructors know to allow you to use weights and be effective. For us, the main thing is do everything in a chest-out type posture. If you lock your back in place, stick your chest out, then do your weightlifting, it's safer on your spine. That's a general rule to follow for the strengthening. In terms of trunk flexibility, I put that last because I think too often using static active or passive stretching, such as the crossovers and other types of exercises, is of no benefit to your spine. It doesn't provide you a protective range of motion in your spine, and many people are injured doing those types of exercises. Look to the more dynamic, even ballistic type stretches. So, for example, if you're a dance performer, how do you warm up for your dance? Well, you do the moves you're going to have to do in that dance. That's how you warm up. And you've done that all week in preparation for that dance. If you're a defensive back, you're out in the field doing crossovers. You're doing the type of flexibility, dynamic flexibility things that you're going to do in the performance or in the game. That's how you warm up and how you get protective flexibility for your spine. You do what you're going to have to do in the game. Doing a lot of passive, static type exercises have been shown to actually decrease performance. I don't think it decreases your risk of a spine injury. Doing some different types of extremity type static stretching may be a benefit. That's somebody else's area. But in terms of the spine, use dynamic flexibility. Do your core stabilization. For example, for a warm-up for somebody with a spine problem, whether it's golf or anything else, I'd rather them do their core exercises even for 10 minutes, but do it at the level you're used to doing. So if you're used to doing a level 4 stabilization exercise, pick 3 of them to do as part of your warm-up, but do them at level 4. And that's the best way to wake up your core muscles, if you will, to protect your back during the performance. Then do the dynamic moves that you're going to have to do during the performance to give you the flexibility that you need. So rehab has been a critical part of any non-operative program. If you're going to, for example, I'm a surgeon and done thousands of back surgeries. If I'm going to advise a patient of mine whether to have back surgery or not, it's my obligation to know non-operative care. I have to have a good non-operative treatment program to prevent him from having or her from having to have the surgery. And just like, that gives you a proper perspective on the necessity and the value of the surgery. Also, if I'm going to operate on somebody's back, I need to control the rehabilitation program from the minute of the diagnosis to the minute of return to play. These athletes don't come to us because we necessarily do a better one-level microscopic discectomy. No, they come to us because we take charge of the player's performance for going by what that player wants. The player wants to return to full performance. Well, we've got to have a rehabilitation program that allows the initiation of the sport-specific training that allows him or her to safely get back to their sports at a maximum performance. And we can do that through a properly thought-out rehabilitation program like this one. We've done it many, many times and can have a 90% return to professional sports after one-level microscopic discectomy because we've controlled the rehabilitation from the minute of diagnosis to the return to the sport, along with the help from a lot of people, like the team weight and conditioning people and position coaches and everything else. But at the same time, we provided a safe venue for a return. Thank you very much.